let's have a brief discussion about immunohistochemistry. So it means you have antibodies binding to a histological sample. So those are antibodies to a specific target, and we have the target and we have antibody that binds to target, and then it fluoresces. It has fluorescence associated with it, and that's how we can identify different types of cancer by different types of markers. So those are the common cancers that uh, uses immunohistochemistry for diagnosis and for prognosis purposes. Starting with lymphoma, immunohistochemistry can help in the diagnosis of lymphoma, in determining the type of lymphoma and the prognosis of lymphoma, because different factors, different CD markers are associated with different levels of response to different therapies. So we use not only CD markers, we can also use the T cell receptors. So next up is CA breast, carcinoma breast. We initially use ERPR, estrogen progesterone receptor, if the patient has an ERPR positive breast cancer, then the patient will probably respond to estrogen progesterone blocking, such as drugs, such as tamoxifen. If the patient has Herceptin, if the patient has HER2-neo positive tumor, HER2-neo positive tumor, HER2 receptor, then this patient will respond to Herceptin, also known as trastuzumab. Trastuzumab. This is a monoclonal antibody that binds or blocks the HER2 receptor. Then in the testicular tumor, we can use different markers such as alpha-fetoprotein, ACG, and placental alkaline phosphatase. All of those will suggest a more likelihood of a germ cell tumor. And the germ cell tumors usually respond to chemotherapy. In the diagnosis of prostate cancer, we can use the PSA, prostate-specific antigen, and we can also use the prostatic acid phosphatase. Those will favor a diagnosis of prostate carcinoma. In any undifferentiated cancer, we can use markers such as CEA, we can use cytokeratin, and we can also use epithelial membrane antigen, or EMA. So CEA, cytokeratin, epithelial membrane antigen, or EMA. All of those, if positive, will favor a carcinoma.